For those who don't know me, I'm Elizabeth. I'm the Chief Executive at the Digital Poverty Alliance. And for those of you who don't know the Digital Poverty Alliance, DPA, we are a charitable coalition. So we bring together other charities, businesses and government, in all cases, big and small, national and local, with the shared goal of ending digital poverty in the UK once and for all by 2030, which is an ambitious target. And this covers many different aspects of digital poverty. And sometimes we are talking about the affordability of devices and connectivity. Other times we're talking about skills and support. And growingly, we're also talking about some of the social implications and staying safe online. So, of course, in Mental Health Awareness Month and also All Digital Week across Europe these fortnight as well, we're delighted to welcome Sam Smith from Ripple Suicide Prevention, really talking about how digital technology can provide essential interventions and save lives. Sam, could I ask you to introduce yourself and Ripple?
Of course, Ian, thank you. Yeah, so I'm Sam. I work as the Education Advocate and Development Manager at Ripple, which I'm incredibly proud to do. Ripple is a suicide prevention charity that provides a online safeguarding tool, a suicide prevention intervention tool, which I'm sure we'll talk about in a bit more detail. And it's doing amazing things, safeguarding people from all walks of life, all backgrounds, in this very sort of challenging topic and area, and supporting people digitally.
Fantastic. Thank you, Sam. Just before we get into the conversation we're going to have today, fantastic to see so many people joining. Please do, in the chat, let us know who you are, what organisation you're representing, and whereabouts in the country you are. Thrilled to already have Swain here from the Orkneys, so we are spreading far and wide, which is fantastic. If you have a question, there's a little Q&A function down at the bottom of the screen. If you're watching this live, please do pop your questions in there as we go along, and we will come to as many as we can at the end of the session. But Sam, just to kind of kick us off and orientate us a little bit with the story of Ripple, could you tell us a little bit about how your journey with Ripple Suicide Prevention began? What was the motivation to focus on digital solutions to mental health?
Yeah, no, brilliant. Yeah, so my background personally, originally, I worked in law enforcement. I was a police officer, so I actually experienced things like mental health firsthand. You know, as a first responder to that, I found I was a very victim-focused police officer. I do think there's different types, and that's very much my sort of motivation to be in that role. I also experienced that there was a lot of trauma within the role of policing as well. So I've got a real passion and a better understanding for mental health. Sadly, I was often attending attempted and sadly successful suicides as well as a first responder. So this was something I was very heavily exposed to. After I decided to move on from my policing role, I specialised in children's wellbeing safeguarding. I worked with all different children from different backgrounds. Again, a lot with sort of the work you probably aligned to, a lot of children from families that maybe had less access to support services and devices and stuff. So it really nucleates there. So I had a real passion for supporting people and young people within mental health and well-being reasons. And when I saw the Ripple Suicide Prevention Charity, I think I probably found it through LinkedIn or something. I think I was well connected to that kind of person. I was doing a lot of advocating and campaigning for better mental health in the UK. I sort of learned about the charity, and Alice, who's our CEO and the founder, her story, and I was really inspired, and I thought that is the kind of organization I want to put my passion into. It just so happened to be the opportunity came about where they were obviously looking for a role to really sort of push the education sector with the tool. With my background in education, law enforcement, safeguarding, and mental health, it was to me the perfect role for me, and I'm very happy I found it. The story of Ripple is it was founded sadly through the loss of Alice's brother Josh, who sadly took his life to suicide in 2020. Alice very inspiringly took such an awful thing to happen and said, we don't want this to happen to any more people. And the Ripple tool was created. It was realized that a huge amount of people and a huge amount of young people were using online connectivity, the internet, to search for incredibly harmful content related to suicide and self-harm. And this was leading a lot of people, sadly, to lose their lives to suicide. And many people know or might not know that suicide is the biggest loss of life to people up to the age of 35. Extends to a little bit older to 55 for males. So this is something I'm really passionate about, being able to share my passion and my voice, and hopefully together alongside other organisations such as you guys, make an impact and really sort of change the way we do things in the UK and save some lives along the way.
What an amazing journey, actually, both in terms of your personal experience and then, of course, how the Ripple tool sadly came about, but hopefully can do so much to save so many. Just before we sort of dive into a few more questions about kind of your approach and where digital comes in, could you just orientate people very briefly by explaining how that Ripple tool works and what that means? Because of course I've realized I'm sitting here from a point of being familiar with what you guys do.
Of course. Yeah, no, brilliant. Thank you. Yes. So effectively, it's actually a very simple tool, and often the simple things are the best. But what it does is it intercepts harmful searches. So if any individual had the Ripple tool on their device and they found themselves in a very difficult position in their life, and that could be for many reasons, and perhaps they thought there wasn't a way forward with them in life, and they were considering sadly taking their life. As we've already established, many people will use the online services and search to find different ways of doing this, whether it's methods, whether it's understanding on how to do certain things. Our tool will pick up if someone writes, for example, how do I take my own life? How do I kill myself? Any terms like that. It will recognize that person is trying to access content that could be very harmful to them. And then what it does is it redirects them to our message of hope. So it's the Ripple message of hope, which is a page which first they go through a gentle breathing exercise just to naturally pause them from that moment. And then they land on our message of hope. It says you deserve to feel hope. And then they're given different signposting services to get support, along with different resources on there. For example, there's really useful videos with people from all walks of life, different backgrounds, different experiences, sharing their experiences with things from ADHD to neurodiversity. We've got people talking about depression, people talking about gender specific issues. It's very broad to the advice and questions and support you can get on there. What I always find really clever about the tool is it kind of mirrors actually what people have said for years that they've experienced when they're going through this journey. There was a person who shared his experience of his suicide attempt, and he explained that he'd driven miles away from his family and he was walking down a pier with the bid to sadly jump off the end and attempt to drown. He'd driven some distance away from his family, who he loved, but he was an ex-military man, and he had real difficulties with his mental health, and he was struggling, and he just felt the overwhelming feeling that he shouldn't be here and he couldn't be here, even though he had so much he wanted to be there for. He said as he walked down the pier, every person he walked past, part of him just thought, I want them to find an answer, I want them to stop me, I want them to say something, but of course no one did, no one knew. He went ahead, and the overwhelming feeling to take his life meant he jumped off the end of the pier. Fortunately, he was found, he was saved, and he was able to share his story. What the Ripple tool does is it finds that person at that point where they are thinking about something or exploring something, and it says just stop for a second, they can think about this, you are important. Yes, we can't make everything magically go away, and nothing, life is going to be difficult, but there's other people who've experienced this, listen to their stories, reach out to somebody. And it does it in a really, really clever way where it's uninvasive, it's really private, and it's really timely at the perfect time. And actually sometimes that's all you need, because can be a very quick and dangerous slope. As soon as someone starts accessing this harmful content, it might be too late. It can sort of negatively snowball from that point on, and it could be not that long until sadly they're successful in losing their life to suicide.
evidently a huge amount of learning has gone into the tool and actually the support that people need at that moment, and
Yes.
ensuring that that is um, really built on the experiences, I suspect, of so many of the people that you've worked with and heard those stories from. Of course, in anything digital, and especially sort of post GDPR, when people became a lot more aware of the fact that so much data is collected, privacy and data protection is something so incredibly sensitive, has to be paramount. How do you approach those concerns within the Ripple system?
Yeah, when Ripple's been developed, it was thought about a lot actually. When we're talking about what we're talking about as suicide, self-harm, and mental health, very, very private and personal. And yes, as I think as a nation, we are much better at being a bit more open talking about it, but people are still quite afraid of the topic. And people also, there's a lot of stigma, and stigma can sometimes be the reason people don't talk. So it was really important that the tool was accessible and I guess able to be delivered to absolutely anybody, and no one would feel that they were being judged or put off or rediverted. The idea that the tool would be monitoring you and effectively reporting you to someone would be incredibly negative to the user experience. And we've only really got one chance to possibly change someone maybe in that moment. So it's really important. It appeals to everyone for that reason. Data wise, we don't take any personal data. So although we do know how many people we are intercepting on harmful searches, we don't know who they are. So it's incredibly private. So anyone can have this tool on their system. If you are a company or a school, an organization, you can put that on someone's system and you don't even need to tell them. It can just be there as a safeguarding tool because you care about the people you work with or the young people you're learning with. And there is no GDPR or data issues with that. And that's what can be so appealing about our tool. It's completely private and all about the end user. It's not about everyone rushing in, and there is other tools that do that, and they have their place in the market absolutely for the right people, but that's not what Ripple does. Ripple is all about that positive intervention at the right time.
Which has to be incredibly important because, as you said, this is incredibly personal, it's incredibly private, and certainly in an organizational setting, not only would users probably feel quite uncomfortable if they thought
Yeah.
that was being sort of reported up or passed along. I suspect a lot of organizations wouldn't want the almost the burden of holding that
Yeah.
data and how that's curated. So doing that in that fantastic way where actually nobody ever sort of knows, nobody knows who's been looking at what, that's perfect. That should be actually how it is, but people get the support that they need without any of those concerns. And we tend to hear a lot, and we've very much started down the road of all the dangers that the internet holds. But of course, part of what we're looking at here is a technical solution, not a negative. What do you think are maybe some of the main benefits to using technology to actively support mental health, and how does Ripple achieve that?
So ironically, I guess Ripple was created because of the negative side of technology. So I think we have to now accept technology is here to stay. We're not going to go. It's not one of those things where we go, "Oh, it was a good idea," but I think that will be faded out in a few years. This is our lives now. I think back to when I was a child, technology was at that point where people used it. It wasn't so necessarily necessary in everyone's lives, but now it's kind of, if you don't have it, you are really disadvantaged. So we've got to accept we're going to have access, make people accessible to it. But we've got to say, well, how can we then make sure that we are understanding the negative sides to that, and how are we offsetting that? Now, with any positive, there'll be always someone trying to, potentially take advantage of that and harm people, and that's what we're seeing. We're seeing people effectively grooming vulnerable people, or people who are at a really difficult page in their life to actually go ahead and take their lives. You can go on a forum where someone will literally send you a kit through the post, potentially from a different country, very easily, which will facilitate your death, your suicide. So the positive side of us is understanding that the platform where people are often starting off and going down this negative route is where we need to provide the tool. And that's why the Ripple tool, we provide awareness and we advocate for changes in loads of different areas, but also our tool is actually built in at the time that person needs it. on the device they need it on. So it's perfectly understanding that we know people will be using the internet for many great things. We don't, again, our tool doesn't block information. We're not there to tell people where they should and should not go on, because actually we do have that freedom. We should have that freedom in society to a point, but we are there to understand if someone is potentially going to access harmful content. We can jump in at the right time and hopefully change their journey, have that positive ripple effect. So I think it's kind of understanding there. We could try and think we live in a world where, okay, well, we'll just block everything, or we'll just remove all this content. It's just not realistic. We can remove one harmful forum, another 5 will be remade within seconds. So we're understanding actually the human nature of this, and actually the best way we can help people is to get them to self understand their worth and how important everyone is, and get them to have that positive journey where they can then get support from the correct services. You know, when you go onto the Ripple tool, you've got access to the NHS, you've got crisis lines, you've got Samaritans. These are all organizations that will help anybody, and that's really important, that our tool will be for everybody, not just a certain area of society. It's everyone, and we're always considering how we can make the tool even more inclusive and support people for their own personal mental health journey to why they may be considering suicide.
And I mean, picking up on that, you mentioned that need for it to be for everyone, and it would be a strange situation actually if organisations were listening to this and going, "Oh well, that would never affect anybody who works with us," because actually, you just don't know. But the flip side of that is, and you mentioned it earlier, around people who are perhaps not as digitally savvy as many other people are. We tend to see it a lot, particularly in terms of parents' concerns around what their children will access when they're receiving a device for the first time. The parent has not grown up knowing how to use the internet and how to stay safe online. So how do they pass that information on to their child when they don't have that information to pass on? So how do you at Ripple sort of imagine getting the tool out to as many people as possible, particularly those people who are maybe they've been living in digital poverty, they're coming to the internet for the first time? I imagine there's a lot of awareness raising that you've got going on at Ripple at the moment to get the word out.
Yeah, I mean, firstly, I'd say our biggest thing, our aim is to save as many lives with our tool as possible. We've been very humbled, I guess, to have had quite a few people reach out to the charity to say how the Ripple tool has intervened on their search and saved their lives. And that's what really drives us to carry on doing this, because even if it only ever saved one life to us, it would be worth it, but we know it's saving many. So it's not about saying, oh, well, you only get this as a luxury. This isn't a luxury. This is something everyone deserves. So within our absolute, the reasons that obviously there's some limitations, unfortunately, we will try and get out to absolutely everyone. And the way we do that is I look after education, for example. Every school, college, university in this country, and I say this country, in any country actually, would be eligible to have the Ripple tool, to the point that if there is a country who is interested in having it within their schooling system, we will create a version for them, because obviously they're not going to be signposted to the NHS, and we will work with them and the right people to make sure that can happen. We don't have borders, because people are people and everyone deserves, help and support. And that's how our ethos as a charity is, that we will help anybody. Obviously, we have this browser extension that can go across any device within a school. So when we know schools are giving out devices, or the children are using them on, for example, the libraries, for example, they've got that safeguarding element. But we extend more than that. We're saying, actually, schools, can you tell the parents and guardians that this tool is accessible for download on your own devices for free? Now, obviously, there is an element where there is an area where organisations will pay to use the tool. That's part of our way we fund as a charity, because we have to be able to exist. But we are making sure that we are getting it to the right people, and that there isn't barriers. Another way we can do this is we have train stations across the UK that have the Ripple tool embedded within their Wi-Fi. So if you were someone who was going down that suicide ideation route, and you'd found yourself at a train station, as sadly many people do, and you were contemplating taking that step onto the tracks in front of a train, actually that is incredibly difficult thing to bring yourself to do, but people are doing it, and actually at that stage maybe they'll want to reassure themselves, and what people do is they question, how do I do this right? How do I do this so it doesn't go wrong? How do I make sure it ends quickly? And these are awful things to search, but people will, because they want it to be quick and over. And actually at that point, Ripple tool will see, oh my goodness, this person needs a better help, they're at a bad time, and it will intercept that interception, just that moment of hope and positivity, and saying, look, you're important, may make them go, do you know what am I doing? I want to go home, and go home and re-talk to someone. It might be that they don't use the services in the Ripple tool, but they're there if they want them. But it might be they just go and speak to their partner and say, I've been really struggling. And then they say, look, nothing's worth that. Let's work through this together. So the psychological and the impact of something so small can be so great. So that's why we want to use it everywhere. We have football clubs using it. West Ham have used it across their London stadium. It's really quite diverse. We have bars using it across their bars and pubs, but we also have people using it for their members of staff. Another way is for us to be able to work with organizations such as you guys, the Digital Poverty Alliance, and say, actually, you are finding individuals who need support and access to devices, because otherwise they are not being put in a fair chance in society, because actually we are so digitally dependent these days to do things. But actually we can say, actually, you're a charity, please take our tool, and where you can, put the tool on there. Obviously there's sometimes limitations because it depends where the device comes from, but if you are able to put that on there, please do. And we will, we will work with other organizations in that way too.
Incredibly interesting that it can be put on Wi-Fi networks as well as on devices, because of course, from our perspective and thinking about the affordability questions around getting online, we know so many people are so reliant on shared Wi-Fi. They're not able to afford broadband in the home. They're not able to afford sufficient mobile data, so they're using, whether it's open roaming or whether it's the free Wi-Fi in a well-known fast food chain, that's actually how they're getting online. So being able to offer the tool through those locations has to be such a great way of reaching so many people. And you've started to touch there on some of the collaborations that you have, so particularly thinking about railway stations. But what are some of the other key organisations that you're working with to really enhance this as an intervention?
So myself, I work with a lot of other charities, education providers. We'll have discussions with the likes of NSBCC, Bernardo's, because they are all in the same sort of mission to safeguard people. But we're able to give our sort of expertise and advice. I've also supported national guidance that will come out later, supporting education in making sure that environments are kept safe and preventing environments becoming easily accessible for people to take their lives. So it's very broad who we'll work with. And actually, something I've been incredibly inspired by and proud with, Ripple will speak to anybody. There's no sort of, there's anyone too big or too small to talk to us, because we're in it together. And I actually think something that we need to see more of is collaborative charities, understanding how you can support each other. I've been speaking to some charities today who support the alcohol and drinks hospitality industry in the way that we can support them in reducing the harm of alcohol to people. We also have a huge wealth of expertise from volunteers who are helping us as a charity make our tool better by giving their expert or lived experiences on how the tool can use language to support people. So, for example, we have a group of people who support neurodiversity and understand what kind of things that people from that background may be searching for in a bid to harm themselves. We've got people on boards talking about divorce, gambling. It's so diverse where we have it. That's just a few to say that there's so many of them, and these great people are able to enrich our tool with intelligence as well. A phrase that a lot of people wouldn't associate searching for, which can be harmful, is I've run out of shampoo and conditioner at the same time. Now, that sounds very bizarre why that would be a harmful search, but actually that is linked to a suicide forum where people can actually find some very harmful content. And partly what people are doing, people who want to try and take advantage of and guess bypass exist some safeguarding provisions, is they are deliberately connecting harmful searches with words that aren't related to harm. But we are able to use our great network of people and supporters and partners to tell us about these things, these trends. Sometimes they're regional, and I might not know down in the south, and it might be something that they're using terminology up north, and we can add that to our word bank. So then when people are using the Ripple tool and using those words, they're not being missed. So that where people are trying to abuse safeguarding tools like ours, we are keeping ahead of the trend and on the trend to make sure we are protecting as many people as possible.
Ever horrifying that there's so many people who would want to take advantage of people in such a way where they would be using actually such bizarre phrases and connecting
Yeah.
them to such dark content. But such is the nature of society, unfortunately, and it's amazing that there are people like yourselves and Alice who are sort of standing up and really thinking about how to ensure that as many people as possible can be saved. And are you seeing public perception around digital mental health interventions evolve? Are you sort of seeing growing support for the credibility and effectiveness of these kinds of tools?
I think so, because I think as our digital capabilities as a country or a world are advancing, it also the way sort of information is spread is, so we've got social media now, so everyone's got an opinion and you can now share your opinion. So actually voices have to be heard a little bit more these days. And if I talk about the education industry now, sadly, suicide is really, really high in younger people. As I mentioned before, it's the largest loss of life to people up to the age of 35. So obviously, if you are an education provider, you're going to sadly be at a high risk of seeing that amongst your students. And actually, we've got all different education providers, all the way from primary schools to up to higher education and universities. And there is a lot of media stuff asking, where you've got families who've lost loved ones asking, for example, universities, can they do more? There is certain policies in place to support schools and education, keeping children safe in education, for example, which is a policy to support this kind of thing. But actually, there isn't probably enough around suicide prevention on these policies, and we as a charity can advocate for more for that, and say that actually this isn't a small little area that needs to be sort of put on a list of things to do. This needs to be done now, because the more we can intervene and the more support we can get for this, the more people we will save. And you're hearing the voice of grieving parents and families and brothers and sisters saying enough is enough. If you're not going to do it, we're going to start shouting until it happens, because this is too important. And that's also why we don't want to put reduce as many barriers as possible to anyone having the tool within reason, so that there's no reason that they can't have it if they believe in it. And actually, I think it can be quite dangerous, because with anything around this sort of topic, there will be some, I'll call them old-fashioned viewpoints, where people don't necessarily believe in all this or have quite a lot of stigmatized ideas around this. And it's important we educate and talk about this kind of thing. I think a lot of the time people worry, if you talk about suicide, something bad is going to happen, but actually quite the opposite. The more we talk about it, the more we embrace it and learn about it as a greater nation, a greater community, the more we can help each other and overcome it. And I think that's really what we're trying to push for. Don't be shy about saying the word, because actually not talking about it is why we're losing so many people, because they didn't think they could talk to you, or they didn't think they could go to someone, or they felt a sense of shame that they should have never felt.
And certainly we are starting to sort of see that shift, but it does feel potentially generational, it feels potentially cultural.
Mm.
We certainly we've seen, I am a mental health first aider, we've sort of started to see the growth of that terminology and that qualification in organizations. But it really does all come to people feeling like they can talk about their concerns, and they can talk about actually what's going on in their life without some of the judgment that maybe certainly existed easily 20 years ago, even 10 years ago, and certainly in many communities it still feels like there is some of that stigma very much attached to raising any concerns about yourself, which is awful, because everybody
Yes.
at some point is going to be on a mental health sort of journey somewhere. Um, and you alluded earlier when we were talking about sort of data collection that you can see the number of lives that you've potentially saved sheerly through the number of searches that have been intercepted.
Yeah.
How else do you measure the impact? Do you tend to focus on metrics? Do you tend to focus on people getting in touch to share their story?
So yeah, that's a really interesting question. So we, as you say, we can see how many people have downloaded the tool or are using the tool. It's really to say using the tool, because I would hope most people would have it on their device. They might not even know it's on their device and never have to come across it, never see it. But hopefully the ones that need it do. So we've had, I mean, this is just the last time that we looked. This will be a bigger number now, but last time I looked, it was about 37,000 interventions have been made. And, we have a huge amount of users, close to 2 million, but actually that's only a drop in the ocean, really, because, we've got a population which is growing, and we've got about 70 million people here alone. And we will support any country with this. So firstly, we can see, as I say, how many people have had intersections, but it's a little bit more than just that. We can also see people's journey with the tool. So if I was a genuine person who was contemplating hurting myself in some way, and I was searching for something harmful, and the Ripple tool comes onto my screen, I wasn't expecting that. That's not what I was looking for, but that's what I got originally. Now, there's different behaviors I could show. I could just get rid of it immediately and carry on my search, and some people will do that. Doesn't mean it hasn't had any influence. It may have made me think twice, or I may then click on to one of the services. I might say, okay, well, let's have a look at this, and go on the Samaritan site, for example, the NHS site. We can actually see how many people and what percentage of people are clicking on different services. So that's a really good way of showing people's, I guess, mindsets have been changed, or their journeys are changing to a more positive, and hence the word ripple is that positive ripple effect. We did mention we have had people reach out to the charity and say that, very strong words, that Ripple has saved my life, and that is something I don't know we ever expected, or Alice ever expected when she set up the charity. But I mean, we've had a considerable amount of people contact the charity. We don't rely on that as a way of measuring it, because we can't ever expect anyone to do that. But it's been so humbling and nice that people have, and so rewarding, that people have felt that they wanted to reach out to the charity and say what effect it had on them. I think a big part of the challenge I have when I'm sharing it with education providers, charities, or my colleagues sharing it with other organizations, is getting them to be in the mindset of someone who needs this. I think you mentioned before, some people might say, oh, we wouldn't need this for our organization. And it's actually, well, why wouldn't you? There's probably lots of things I could probably share about myself. People would go, oh, I wouldn't have expected that with you, because we can all judge, and this is the point. Everybody has mental health. If everybody has mental health, everyone runs the risks of that mental health becoming, hindered, or damaged, or need help with it. I hope everyone can live as happy lives as possible every day, but we all know there's certain things in life that will come our way, and different environmental factors. Sometimes it's biological factors. There's so many different factors to what can hinder us, and we sometimes just have to take each day as it goes. But let's not wait to test that. Sometimes we see organizations maybe mentioned in the news where they haven't done enough, and then they're doing something. Let's put something in place before. Where our tool is, for an organization, they can purchase it for their employees. It works out at pence per an employee, to do this. And actually, I wouldn't ever obsess over how many people it's intercepted within their organization. Just know the common good, it is helping people. Hope that none of your organization, your staff members, ever actually need it, because none of them are in a position where they want to search for such harmful content. But if they do, be so glad it's there, because that could just save their life. And I think that's how people need to start seeing this kind of technology and this support. I think people get very obsessed about results and it showing that it's worked, but you don't want to be wishing that it works, in the sense that you don't want to wish that people are searching for this stuff. And that's how we need to start looking at things, better safeguarding what we already know exists.
Yes, and if we were only ever going to wait for results, the insurance industry would go bust overnight, because the entire point
Yes.
is that you have something against the day you might need it,
Yeah,
not
and I
if you're
hope,
waiting.
and you're right, and I hope you never need it. And I, really, it'd be great to think no one will ever need the Ripple tool ever again. But unfortunately, data and statistics, and we know unfortunately that's not the case, and people will need it.
Yeah. Thank you, Sam. That's been incredibly and interesting, and for such a sensitive topic, actually incredibly inspiring that there is so much work going on at Ripple Suicide Prevention to really make sure that people are able to access this support at the point where they need it. We've got a few questions from some of our live attendees. So starting with a couple of questions from Swain, and I'll take them separately. It's a great tool, he says, with clear and obvious benefits and little or no downside. Have you explored getting the tool embedded into any of the main browsers so that it would just be enabled automatically for anyone using that browser?
I certainly personally haven't, because that's not really my role within the charity. But to say the charity haven't, I think they have had conversations. It's hard for me to say where those conversations gone. And I think they're very complex. I mean, in an ideal world, we'd love that to happen. And if any of the browsers and anyone works for a browser wants to reach out to Ripple, I'm sure we would definitely take that conversation and see if we could do that. That would be amazing. I'm not to say conversations haven't happened or maybe having about it. It's probably a little bit not in my area, but it's absolutely the way we'd like to see it being used. Yes, that'd be brilliant.
Tell your friends, basically, if you happen to know anyone working at any of the major browsers,
Yeah,
please do. Spread the
yes,
word.
exactly. Yes, please. Yeah, thank you.
And similarly, another sort of question slash idea from Swain is around the university Wi-Fi system, so EduRoam Wi-Fi system, and whether there's been any sort of conversations about getting that embedded in the same way as within railway stations.
Yes, I mean, universities are quite mixed how they work. So some of them are quite different. So, some universities will just provide their own Wi-Fi. Some have like an outsourcing organization that runs their Wi-Fi for them. We've got it across many universities are using it in that way. It's very hard to sort of just get everyone to do it because every single organization have their own opinions. It's amazing you can have a very positive conversation with a university who are like, this is brilliant, we're having it tomorrow. And then others who just it doesn't go anywhere with. And that's a part of us advocating as well and getting that message because, those people aren't necessarily wrong to have that maybe doubt or that concern. That's just where their journey in life has taken them. Now, obviously, they know what they know and they understand what they understand. We believe that is important for everyone to have it. So yeah, we certainly are in conversations with all different ways to get it into education. I can do it one way. I can ring up every single school, college, university in this country and other countries. But there's only one of me. So actually, we always are looking to try and get it on a sort of across bigger scales. There is organisations I won't mention in particular who work with a lot of universities, and we'll have conversations with them, and they are very positive about trying to use our solution across all of their universities to almost take that decision away from the university because they believe it's the right thing. So there's so many different ways we are exploring and working. And again, if anyone ever wants to reach out or they come from a background that they think they can help. And another thing, if we all have children in our lives, most of us, in one way or another, whether it's a sibling, a son, a daughter, or your various other relations or a friend. Everyone's school should have this, secondary, primary, college, in one way or another, whether it's not the Wi-Fi version, because of the browser extension is free. So if anyone wants to advocate it or me to speak to their schools, we will do that. There is no school too small for me to speak to. If it was a primary school that only looked after 10 students, I would still have a conversation with them because they deserve it. And if that's what they want, they can have it.
Fantastic. I hope that there's people on this call who are going, "Ooh, I know somebody who works in the education department," or "I know we've got a few local authorities on." So do be thinking about how you can get that word out. Talking of local authorities, so Gail, who does incredible work at Norfolk County Council, says that she's refurbished and gifted around 1,400 laptops in the last financial year to vulnerable people in their community. So she says, is this something we could put on our devices, as these are generally going to vulnerable adults and young people, and would there be a cost in that situation?
Nope, the browser extension for that purpose would be absolutely free. please take it. We would be absolutely chuffed to think that's how you were using the tool. It's great that we can give these devices to people, as I think we know that, from the work that, you guys do in the DPA, that this is so important that we're not restricting people from being able to go online and do what so many of us are doing.
Ooh, Sam, we've lost you. I can't hear you.
Seconds.
Oh, there we go.
Can you hear me now?
You're back. Yes.
Sorry, I think my headset went there. Apologies. Yeah, I was just saying, if there is a way we can give devices to people who are vulnerable or in need of it, knowing that unfortunately there's always a risk that that device has a bit of harm associated with it or may do, and we can offset that or at least put something else to safeguarding it. That's exactly how we want the tool to be used. So get in touch. I don't know about the ones that have already been given out. That might be a bit more difficult because you're in, but of course, get in touch and we can explore how we work to do that.
Brilliant. And we will share some links in the chat. And I will also in a minute, Sam, just ask you to let people know how they can get in touch if they are watching this afterwards and therefore don't have the chat. Last question from our audience, which is, are you looking into how AI responds when people ask about suicide? So ChatGPT-4, for example.
It's not something I can say too much about just because it's not an area we've explored in great detail. I know we've talked about AI. It's something we're aware of. We are a small collection of people, and it's something we would probably look into in more detail. We always think you've got to be very careful to launch with something without it being safe. Because we are a suicide prevention tool, not a well-being tool, we can't get it wrong. So with well-being, you can be quite experimental. Like, for example, what I would be good for my well-being, maybe I like to exercise or go for a run, and someone else says, no, why I prefer to do yoga, and I'll be like, I'll try it, but it might not be for me. And if it's not for me, it's not done me any harm. With suicide prevention, we can't be too experimental. So I think we are curious about AI in a positive way to how it could be positive, but we will be treading carefully with it because of the nature of the work we do. And I think that's probably all I can say on that at the moment. I'm not super technical minded, so I find it fascinating. There's many more in my team who know way more about what AI can do, positive and negative. But from a well-being point of view, I think maybe we could possibly get somewhere where we're utilizing it for the good. But it's not going to be tomorrow, put it that way. I think a lot of thought has to be put into these things when you're dealing with a topic we deal with.
No doubt, though, many opportunities to grow how the tool can work and the number of platforms that it can support, and that can only be to the good.
Yeah. Ripple will definitely be across more and more platforms, and I think we'll start to see it doing more and more support. I mean, even for the few years it's been in operation, the terminology used on it, the way the tool actually supports people has just grown and grown and grown, and it's really exciting to see. And also because we have such a great, I guess, community of people supporting the tool from all different backgrounds, we're always able to take advice and take information and intel and have discussions about things like AI and explore how we can further use the tool. I wouldn't be surprised if it eventually can support people in that way. I just think it's quite a new technology. So I said, got to be careful that you're not going to do something that actually is going to cause more harm than good, because we're not quite there with understanding it, sort of thing.
And we do have a little bit more time. Another couple of questions have come in. So Leanne has asked, and this is really fundamental given how many young people are using smartphones. Are there plans to look at a solution that would work on mobile phones, given the high proportion of people who are mainly accessing content on a phone?
Yeah, it's something we're ongoing looking at. The technology is just different. That's the only reason it doesn't exist at the moment. It's not that we don't want it or think it's important. It's something that we definitely have been and are ongoing looking at. When that will happen, I can't say. All I can say is, as I guess another way of supporting the Wi-Fi, if you do use that solution within your community, within your network, that will support a phone search. So if you were an education provision, say a university, and you had the Wi-Fi and the student was using their phone to get the harmful content or try to, it will support them with a Ripple tool. So the Wi-Fi does. The browser extension can only be installed on laptops and PCs. So there is some areas, I guess, that we were trying to fill in the gaps. So you're going to have home use, you can have it on all your devices, but you won't be able to have it through the Wi-Fi at home at the moment, unfortunately. So if we can, we will develop it. I'm sure we will eventually. I can't say when, unfortunately, but it's, you know, as with technology, we're trying to get there as soon as we can.
And as we know, technology changes so fast, and individual charities can only do so much to keep up on their own. So it sounds like you are pedaling very fast to keep up with rapidly changing environment. And Jamie's just asked, and you may not have the immediate answer to this, but what's the cost for the Wi-Fi installation? You probably can't give a firm.
It's really hard to say.
Indication.
It will work out. It depends what sort of organisation you are, but it works out pence per person. So if you want to say how much am I investing in my employees, it's nothing per person of how much you're spending on them, and it could save their life. That's probably the best way. What I'll say is, if you're interested in, we have discussions about it. You know, there is a way we price it in different ways, depending on the organisation, because we always want to make sure it's fair. So, you know, we make sure with education, for example, we're making sure it's affordable and realistic, but it's usually done as a conversation. There is some price guide lines probably on our website, but it's probably easier for them to just look at it and see how it works and have a conversation with us. But it's not an expensive resource considering what it could do for someone.
Amazing, Sam. And if people want to get in touch with you or with Ripple, or they go away and they have a conversation, go, I really need to get back onto this, where could people find out more? What's your web address?
So obviously we've got so personally you can contact me. I mean, I look after education and I look after charity. However, if you contact me, I can always pass you on to my colleague who looks after the more corporate side of things. My email is literally sam.smith@ripplesuicideprevention.com. Hopefully we can send out some links to our website as well. So there's also a get in touch via there. So if for some reason you didn't want to speak to me, or you just wanted to look at some first and then you've got my email, that's fine. Reach out through there and that will go to the right person. We're a very small team. So we all know each other very well and we're all very connected. So it doesn't matter who it goes to, it will end up at the right person's desk. Also, if you go on our website, you will be able to see a demo of the tool, pre-recorded demo. There is also FAQs on there. So obviously a lot of people have a lot of the same questions. They will show you a little bit more about the two options of the tool and how they can work for different industries. So we've got an education part to the site. We've got a company part to the site for like employee well-being. We also have some free resources on there that you can download and use. We're always looking to new things. We've got loads of things in the pipeline. Obviously can't share everything because some of it's just ideas at this point, but there's lots of exciting stuff. You know, we always ask if people can support the charity as well. We are a charity, so any way they can, fundraise and stuff like that's always welcome. And get the word out. You know, as I said, you know, we will give a browser extension to everyone for free at home if they want it. You can access that on our website too. All it asks for is a few details just so we know who you are, and then we'll give you access to it. So, you know, we want to be as easily accessible as possible and make the process as easy as possible. And if there's anything that someone wants a question, we'll always talk to anybody. You know, we're never going to just, if you want to pick up the phone call, have a Zoom call, have a Teams call, have a phone call, or just do an email, let us know and we'll have a chat with you.
Sam, that is fantastic. And I really do hope that lots of people here are going to be filling your inbox. Now you've given your email address out. And I can see we've even put your email address in the chat.
Oh, perfect. So lovely.
Hopefully you can have a lot of
technology. Thank you.
Thank you to everyone for coming along. It can be a really difficult topic, and it can even feel like quite a step to come to a webinar such as this just to learn a little bit more. But I really do hope that you will visit ripplesuicideprevention.com and really think about how you can integrate this in what you're doing, whether that's for your organisation, whether you are supporting people who may be able to benefit through this, for example, through gifted devices, or whether you are perhaps looking after children who may be able to benefit from that on their laptops. Really do take a good look at whether that could be something that could work for you. Thank you also for continuing to support the DPA by coming along to our webinar series. Our next event is going to be the launch of our National Delivery Plan on the 4th of June. If you happen to be in the vicinity of Carlisle or fancy a trip to Carlisle in the on the edges of the Lake District, please do sign up. We'd love to see you there, and I'll pop the link in the chat. You can also watch that session hybrid, and you'll be hearing about the progress that we've made to date over the first year of phase 1 of our NDP. You'll be hearing about some of our new priority areas, which will include media literacy, which has a very close tie-in to online safety. And you will also have the chance to engage with some of the panels and discussions that will be taking place on the day. So do sign up for that. Otherwise, we will see you soon online for our next in the webinar series. Take care, everyone. Thanks so much.